quick reminder of what labs can look like at someone in perimenopause. You do not need labs to diagnose perimenopause. It is not a lab. We don't need labs for perimenopause, but I had a patient yesterday that was very interesting. So if you're a clinician or a provider or a patient, this is education on what your labs might look like, what can help me narrow down that you're in perimenopause. So for this patient that I saw yesterday was having symptoms of perimenopause. And one of those symptoms was she was having a cycle and then 1 a week and then had a cycle again. And when she did her labs, her estrogen was 386 picograms per milliliter. So that's very high. And so what I caught her labs were in what we call a loop cycle or a luteal out of phase cycle. When you kind of double ovulate or you ovulate during your luteal phase because the FSH drive is so high to get estrogen out. And so just like asking, oh, please, can I have some estrogen? The FSH from the brain down to the ovaries, it's like banging down the door, and then it does, it's trying to get that estrogen out. It gets a little bit of estrogen, but then that banging happens, and then you release more estrogen, which can cause a lot of symptoms. She was having neck hypersensitivity. She had, tightness and was not feeling well. And so in those labs, in that instance, I actually increased her estrogen. She was on a low dose patch, the lowest dose, 0.025 milligrams of estrogen. I actually increased her dose despite her levels being so high because, trying to drive that drive down. So that was helpful for me to see she's having some big swings because the patch I'm giving her at 0.025 is not providing 386 picograms per milliliter of estrogen at all. That's her own doing. Plus her symptoms gave me that recommendation to do for her. And then I also increased her progesterone as well to see if we can't try to blunt the highs and lows of her hormones. And the other thing that I'll see in labs, which again, symptoms matter most, but what I'll see in labs is kind of like this no man's land FSH. When I do labs day 3 to 5 of cycle, and FSH should be like less than 8, less than 10, but I'll see FSHs that are 14, 15, 16, 20. They're not quite above 25, which is postmenopausal. And so obviously they're having cycles that they're not menopausal. But when their FSH is above, kind of in this weird range, not quite postmenopausal, but not quite normal, that also can give me clues to know what we need to do depending on, what their symptoms are. So again, symptoms matter more, but I was getting labs for her thyroid anyways. So it was sort of incidental, and it helped me make this decision making. But I think if I didn't have those labs, I probably would have made that decision as well. But they can be helpful to see what's going on. And if you catch any of these things on your labs, if you're a clinician, or if you're a patient, it can help you see someone might think I'm not going to increase your estrogen because your estrogen's 386, you don't need enough. But that means that, what goes up must come down. And that's the symptoms that she was feeling. And that's what perimenopause is, these rapid fluctuations of high and low of estrogen that are, affect your neurotransmitters, affect your brain, affect every part of your body. And some women don't feel it, but others really do. And so hopefully by increasing her estrogen, she's going to feel better. But I just got reminded because I'm working on her note and I got to go finish that.